and say good afternoon and thank you for joining Green and Healthy Homes Initiative today for the third session in our webinar series on whole house repair programs incorporating electrification measures. I'm Catherine Lee, Director of Client Services with GHHI, and I'm joined today by my colleagues Justin Berry and Colin Choney, and we are so excited to be talking about the Baltimore program today and are really glad that you'll be able to join us. I'll leave the poll open for another minute. Colin, so we ask all of our attendees a question about what they're interested in learning about as they join us today. And the responses that we get are typically a little bit of everything, but it looks like we've got interest from the attendees on workforce training and capacity building efforts, how to assess feasibility of electrifying homes enrolled in whole house repair programs, which is perfect for today. And then our other attendees so far have said that they're interested in all of the above, all the options. So in addition to those, we ask if people are interested in how programs are braiding funding streams and also how they're measuring outcomes for residents and communities engaged in whole house repairs. So I think we've got a lot of interesting content for everyone today as we get started. So I'm going to go ahead and close out the poll. Thank you so much for your responses, everyone. And I will share my screen so we can get into our presentation today. And as we go through our session, if you have questions, we ask that you submit them in the Q&A box, and we will be glad to read those out and respond to the questions as we receive them. So we'll be keeping an eye on that as we go. And I'm going to share my screen. All right. Can everyone see that okay?
Looks good.
Okay, excellent. So it looks like we've had several people who have joined us in previous sessions, but for anyone who may be new and may not know about GHHI, we are a nonprofit organization with our flagship location in Baltimore, Maryland, but we are a national healthy homes organization dedicated to addressing the social determinants of health and the advancement of racial and health equity through the creation of healthy, safe, and energy efficient homes. By delivering a standard of excellence in our work, we aim to eradicate the negative health impacts of unhealthy housing and unjust policies for children, seniors, and families to ensure a better health, economic, and social outcomes in historically disinvested communities, with an emphasis on communities of color. We are hosting this webinar series to really get into the nuts and bolts of whole house repair programs, especially those that are incorporating electrification measures and advancing equitable access to efficiency and electrification measures in homes. So we really wanted to pull this together so our participants would have an opportunity to learn how to access and align, braid, and coordinate resources to make these services available for the households that are most in need, and with a effort to scale decarbonization and electrification measures so no household, regardless of income, is left out of that process in the near and distant future. So we have really designed this to get into some programmatic case studies where we can walk through programs and how they were designed and being implemented and what their outcomes will be. But there are some sort of key themes around best practices for those programs that we think are important to look into and feature. So in each of our sessions, we're looking at the policies that are enabling electrification in alignment with health hazard reduction measures, healthy housing, and energy efficiency programs. We're also looking at who's at the table in supporting partnerships to create alignment and braiding of these funding streams and programmatic coordination to enable a whole house approach that ultimately yields comprehensive, healthy, safe, and efficient housing assessments and intervention work that's phased in a way that will allow for that work to be done in tandem. We're also talking about lessons learned in a lot of our sessions, of course, barriers that different communities have experienced to trying to get this model off the ground and implemented, and then strategies to eliminate those barriers, as well as what people are learning through program evaluation. And we'll also be talking some about community engagement, how community residents and participants in programs are at the table to support program design, marketing, the education resources that help support this work being done, and how work is being evaluated. So the whole house model and what it is, and ensuring that we all have sort of a working definition of what we, sorry about that, is really what we mean by that is it an approach to comprehensively improving residents' housing quality by increasing energy efficiency and ensuring homes with the highest needs of efficiency are not left out of those programs because they have hazardous conditions or need structural repairs or things along those lines to ensure they are eligible to participate in electrification and decarbonization and efficiency measures. So programs that we think of as being a whole house model have certain elements at their core that really enable that work to be done, and not necessarily all of the above, but some common themes and elements that we see are cross-agency coordination and alignment, the braiding of funding streams and enabling multiple funding streams to go into work in one household under one roof, a streamlined client intake process. So we're looking to see if residents being enrolled in programs are eligible for more than one program at the time of intake, doing coordinated scopes of work, having case management support for families, and also doing aligned work in the field by having cross-trained energy auditors and workers performing the remediation and intervention services, or coordinating across agencies to deliver those things in a well-phased manner, and also supporting data collection, management, and sharing to support evaluation. So we're going to talk today about the Baltimore Whole House program. In our previous sessions, we've looked at some other program models that have those common elements and are working to implement a whole house program in Trenton, New Jersey, as well as in Philadelphia, Pennsylvania. We have recordings of those sessions in case you missed them. We may refer to them some today as we're going through, so we'll ensure that everyone has access to those on our YouTube channel. And, today we'll really get into the nuts and bolts of what's happening in Baltimore. So I'll turn it over to Colin.
Thank you, Catherine. Now, to expand a little bit on the previous slide that talked about the whole home process, this graphic really represents the core of how we deliver services. And we refer to this as the GHHI model. Now, if you have attended a previous webinar or worked with our organization, you might be familiar with this. But at the heart of how we deliver services and how we offer services to the families we serve is, first and foremost, we have a one single intake system. And so there is a no wrong door approach. So no matter what motivates a family to come to us or a referral from which program they might be referred from, we bring everybody through a one intake system. This allows us to gather all the necessary applicant documents to determine their income eligibility. And at that point, we can begin to assess which path we're going to take our families through to solve their potential issues. The next step in this is we complete a comprehensive environmental assessment and home energy audit. Our environmental assessment follows a few other established processes. One of them that we follow is identifying the hazards outlined by the HUD Healthy Homes program. And it sets a structure of a data collection process that allows a trained assessor to go through a home and evaluate a home's existing conditions from top to bottom. Upon completion of that, we complete a comprehensive home energy audit. It's usually performed by a BPI certified professional where they utilize sophisticated diagnostic equipment to test the functionality of the existing natural gas appliances in the home, and they use other equipment to measure the airflow, and they do pressure differential testing. And this helps them guide them down of creating an effective scope of work that will improve the performance of the home. In addition to that, we have the coordinated services, and the coordinated services brings together multiple trades to perform work in the home. It could be if it's a plumbing, electrical, HVAC. In GHHI's case, we have internal crews. And so you have to coordinate all these different aspects of the project to be able to get things started. And it can be challenging at different points, especially when you're dealing with the heavy demand of schedules for the other organizations that you're dealing with. Having cross-trained workers is very beneficial. All of our crews, they have multiple certifications. They carry the lead hazard reduction worker. They are certified by BPI as retrofit installers. In addition to that, we do have carpenters that are trained by the Carpenters Union. And we also have some of our internal crews have entry-level electrical skills by local training providers. And probably one of the most important aspects of the work that we do is the shared data, because the data tells the real story of the impact of our work. And we're able to share this real-time information with various partners and also other organizations to help promote and just close the dots on why these funding sources are so important and the outcomes that you can almost recognize if you complete this process. Next slide, please. So we've launched an electrification pilot program towards the tail end of 2022. Our efforts have been focused in Baltimore City. And when we say electrification, we mean a full comprehensive electrification project that removes all natural gas service lines or other fossil fuel service lines to the home, removing those appliances and replacing them with all electric appliances and systems. All of our electrified homes, we braided multiple funding sources to address the health and safety issues in the home and also complete a full energy efficiency retrofit. And I want to point it out that for this pilot program, we will not complete an electrification project unless a full energy efficiency retrofit has been completed on the home, either by our organization or other local organization here in the state of Maryland. We just want to ensure that this home is operating at the highest levels possible. That includes full insulation, air sealing, and just want to make sure that any additional work that we are completing on that house is not going to have the opposite effect on their utility bills and their consumption. Next slide. So we focus on six core measure groups of our electrification measures. Our HVAC system replacement, we either will install a traditional ducted Energy Star heat pump, or for replacing here in Baltimore City, We have a large amount of natural gas or oil boilers that are in use. And so we have installed a lot of mini split heat pumps, and we don't limit it to a certain number. So whatever we complete a manual J to determine the proper sizing and system design, and then we deploy that to the home that we are working in. And obviously, we remove all of the older equipment. The water heater replacement. Our first option is to go towards a heat pump water heater. But as you may or may not know, that there are certain existing conditions that must be met before a heat pump water heater will be effective in a home. And so if those conditions are not met, then we will default to a traditional electric water heater. The stove replacement, we prefer in installing an induction stove just because of the longevity of this appliance and the safety features that go along with it. But again, if the home cannot accommodate an induction stove, then we will pivot to installing a standard electric stove. The dryer replacement, this is something that you see a lot in Baltimore City, is a natural gas dryer. So we what we want to do is we replace it with an electric, but we also upgrade the venting configuration. Most homes that we do enter do not have the proper venting for their dryer, and this poses a significant fire risk. And so we kind of we kill two birds with one stone with this measure. And now for number five, this is kind of a there's a lot of back and forth on if this is the right way to go. There's different opinions, and we are really agnostic when it comes to this, when it comes to electrical upgrades and how it impacts a panel. We decided just based on our housing stock here in Baltimore, the homes that we are completing work were built in the 1920s, and the more than likely the electrical panel has not been upgraded. Most of them is original to the home. And so we feel that if we've got the available funding now, regardless if you're completing an electric load calculation, we do not want to run the risk of putting undue stress on an already outdated electrical panel, which could potentially cause issues for the family down the road, and funding may not be available. So we opt to upgrade the panel, which requires us to also work with the local utility provider because they have to increase the service line to the home. And we would rather just go ahead and take care of this all at once just to ensure maximum functionality of all the newly installed appliances. In addition to the electrical upgrades, if there's any type of knob and tube wiring that would prevent energy efficiency measures from being installed, we're addressing those as well. And if the knob and tube will have an overall impact on the performance of the panel, we go ahead and take care of that as well. And the last one is the old system removal. If there are some cases that we can remove the gas lines without being too intrusive into the home, that we can make the necessary repairs to seal up any penetration points, we will. We do follow EPA guidelines if there's an existing oil tank in the home and removal. The state of Maryland has strict environmental processes that you have to follow, and we follow those accordingly when disposing of an existing oil and propane tanks. And this is a very common question that we're often asked is, what are you doing with the old radiators and boiler lines in a home? And again, it just depends on the accessibility of removing those pipes. Unfortunately, more often than not, we do leave a lot of radiators in a home, and it's just because our funding partners will not allow us to make what essentially equates to a cosmetic repair if you remove a radiator. And so these are the kind of things that we talk with our clients on the front end about what they can expect. And so they're usually in agreement that it's okay to leave the radiators and some of the boiler pipes in the home. And we'll turn it over to Justin Barry.
Awesome. Thanks, Colin. So I'm going to take these next couple of slides. We're going to talk about how our electrification decision points, how we're choosing which homes are priorities for receiving the services Colin mentioned. For those that have been following this series, the last webinar we did 2 weeks ago, I walked through a similar process for our New Jersey program. That webinar is recorded for those that want to catch up on that. This is talking a bit about specific to Baltimore, where we have a lot more different funding streams are braiding together. So I'm not going to take the process of walking through a flow chart here, but describe kind of the questions that guide us as we're making these decisions that Colin and his team are doing. So first point here is GHHI, as we're doing electrification, we're following the structure of existing efficiency programs in Maryland, and we're lucky that there's a few of them that we're able to work with that have good support. So we're following this guidance to identify the cases where major appliances can be replaced based on age, efficiency, or safety criteria. The programs we're working with consistently are DHCD's Empower program, which is the utility efficiency program, the MEA, the Maryland Energy Administration Low Income Efficiency Program, and in some cases, the Department of Energy Weatherization Assistance Program. In Maryland, these programs, as we've set some climate goals, are working towards being able to support fuel switching with more consistency. But we would expect, even if you aren't in a state where that's the case, that there's likely program guidance that could direct to where a major appliance would be replaced. And that can be an entry point to thinking about opportunities to move towards electrification. Maybe there's some policy tweaks that need to happen along the way, but we found it's a helpful starting point. So second piece is GHHI prioritizes households with significant opportunities for utility savings, health, or comfort benefits for electrification measures. So examples of this would include clients with very old systems, such as boilers that aren't heating or cooling the home effectively, clients with asthma or COPD, where the indoor air quality benefits could be significant. Again, if we're moving all the gas appliances, stove, et cetera. Clients without air conditioning. So looking to prioritize those clients. And then 3, GHHI uses flexible gap funding to cover any measures that cannot be fully funded by existing programs. So the slide Colin went through a couple minutes ago, that funnel, the GHHI model, part of what we try to do is make sure we've done the fundraising, whether it's programs with flexible funds or bringing in philanthropy or private funds or others, to be able to take some of these more innovative steps that right now might not necessarily be fully covered by these programs, in the hopes of kind of demonstrating the success of this and being able to provide a really comprehensive scope of work to our clients. So some of those things like electrical wiring and panel upgrades, added costs of a heat pump space or water heater, capping gas lines, those would be some examples of where we've found it particularly helpful to have some gap fundings now, the hope that we can envision a future where those can be covered more consistently under some of the different program structures that might be coming along. So yeah, you can go to the next slide, Catherine. So just to map this out, similar to what I was just saying, a very simplified decision tree here. 1, does the efficiency program allow for replacement of major appliances based on standard criteria? 2, will the client see a benefit from electrification measures? And 3, can we align, braid, coordinate funds to deliver a comprehensive scope of work to the client? So checking through those things, if the answers are yes, then we're looking at that as a priority candidate for our electrification services. You can go to the next slide. Yeah, so then just to add kind of the nuance, that the commentary to each of these, for the programs criteria, some programs may be considering guidance to allow for fuel switching and or greenhouse gas emission reduction goals. We're seeing this right now in Maryland with our Empower program, other places where there's strong climate priorities and goals, starting to see this too. So for those that are engaged with advocacy or have a chance to weigh in on that, maybe an opportunity to pay attention to those things as ways to support being able to implement this on the ground within those programs. On this next point, client engagement being something that we know is really important. Oftentimes these are newer interventions. So in addition to potentially having a learning curve about what an induction stove or what a heat pump is, we want to make sure that the clients are going to be satisfied with the changes to their homes and understand the potential benefits of what we'd be offering with electrification. we don't want to catch people off guard with the fact that their electricity bill goes up from before, if they don't realize that's because they're not having to pay a gas bill anymore. So the net benefit is still saving the money. Wanting to talk through that type of stuff on the front end, and especially if you're dealing with kind of partners on the implementation side, other folks who may be having those conversations with partners, knowing that it's important to find ways to make sure that someone's getting that information clearly and accessibly to clients who are often experiencing something that's a little bit less familiar with these electrification interventions. And then finally, when we're looking at what scope of work we can deliver, in some cases, seeing that full electrification isn't the best fit, either because of the home structure, preferences, funds, and measures we could be providing. So in some cases, we might be putting in a heat pump to cover part of the heating and cooling load, but leaving in another system if there's a working system there. Other times we might be looking at a home where there's a really high need of an electrical system and spending a lot on that, but the appliances don't make sense to replace. That could be what we would consider an electrification ready category, or somewhere in between. Make sure that we're preparing for there to be some nuance in delivering these interventions. So I think that covers the slides I've got. I'm turning it back over to Colin to walk through a case study, which hopefully is helpful for folks.
Thank you, Justin. Before I begin on this, I just wanted to reiterate something that we're very fortunate that state of Maryland has very robust energy efficiency programs with very well-established protocols. And so it really helped us navigate through the questions when and when not to do something. And it is very helpful. And this is one of the things that I think that we recommend the most. Doesn't matter which state that you're in. Take advantage of these established processes and these established programs, and it will help take a lot of the burden off what you're trying to do or create. In addition to that, all of our projects that we are completing the energy efficiency portion of the project is we're energy modeling all of it with the approved software by the program. So if it's a Hancock software, Snug Pro, Beacon, but there's a lot of them out there, and that will also help guide your efforts when trying to navigate the electrification process. And so the case study that we wanted to highlight is, I would say this is an atypical situation that we often come across with the homes that we service here in Baltimore City. It had a big list of health and safety issues negatively impacting a home. The roof failed many years ago. Not only was it causing water damage on the inside, but it was also rotting a lot of the frames of the attic and causing structural issues. Had very poor weatherization. There was little to no attic insulation. The home was not air sealed. Now, here's one that's potentially dangerous, especially to one of the residents that had a COPD, that the natural gas stove was not properly vented. And so every time she was cooking, and the stove was, I believe, almost 40, 50 years old. That stove was emitting high levels of toxic fumes into the home. And unfortunately, it had a significant impact on the health of this family. The bathrooms had zero to no ventilation, which added another layer to the poor indoor air quality of the home. The dryer was not properly vented. The vent was clogged with an excessive amount of lint. And as you know, that's an extreme fire hazard. The natural gas systems in the home were way past its useful life. The central air conditioning was not functioning properly, which means that it was costing almost 2 to 3 times more in the summertime to try to cool the home. And then in addition, there was a senior resident living here, and there was trip and fall hazards throughout the home, which makes it very dangerous for her to move around. Poor lighting and significant plumbing leaks throughout the house as well. Next slide. So the total cost of the project was a little over $59,000. And this really, again, reiterates the importance of why we braid and align our resources. And as you can see, the multiple funding sources that we were able to utilize on this project. This is something that I always like to thank the leadership of Green and Healthy Homes Initiative for having the vision to go out and seek funding from multiple sources to allow us to have these tools to complete these projects. In addition to that, it always can never pass up a shout out to the state of Maryland. As the state of Maryland has one of the most aggressive, largest low-income energy efficiency programs, and that's primarily due to our state legislature enacting the Empower legislation, which helps the utilities fund these programs, which allow this work to be done. And also the city of Baltimore, they created just probably one of the most effective programs, the housing upgrades benefiting seniors. This robust program really improves the lives and health and safety of seniors throughout the city of Baltimore. And this funding has been very important in allowing us to complete this work. So I always like to give my shout outs to our funding partners. And as you can see, the breakdown, the healthy homes and aging in place was a fairly large amount. We were able to address the roof, the plumbing repairs, and also have complete the aging in place measures, which is going to allow this resident to navigate through her home safely. Weatherization, it was a full weatherization retrofit. We maxed out our job cost to $12,000. We insulated the home to R62. We're able to complete some very deep air sealing, added proper ventilation, and also helped with other areas in the performance of the home. And then the electrical upgrades, she was able to get an Energy Star dryer, induction stove, heat pump water heater, and also an Energy Star traditionally ducted heat pump. And so overall, we were able to effectively just completely change the performance of this home. In addition to the great work that was done here, this home is also now what we like to call renewable ready. And so the next step for this family is participation in our solar program. We're based on the upgrades that were already performed in the home in partnership or in conjunction, excuse me, with the solar program. The consumption more than likely will be a net zero production, so she won't have a utility bill any longer.
All right, thanks, Colin. I think that's it for our slides. So we can open up to questions. Here we go. All right, Justin, do you want me to start off on what's in the Q&A or?
Yeah, sure. Let's do that.
Okay, that sounds
yeah, folks see the Q&A option. That's probably the best way to ask us questions. It's easiest for us to track any follow-up if we need it.
great. So this is an excellent question, Colin, that I think you can share a little insight on. We have a audience member who's asking, are you open to testing air quality before and after these whole home renovations and electrification measures? Is that something that you're currently doing or planning on doing in the future?
We are at the infancy of planning. We've had a couple of opportunities to establish some partnerships, but we're trying to figure out what's the best path forward. When you begin testing indoor air quality, you've got to have a thorough testing plan, and I think we're at the early stages of developing one, but that is something that we're definitely interested in doing because the indoor air testing will tell all tales about the benefits of this type of work. And so we're definitely interested in that.
It looks like we have just a comment in the chat. Great job, Colin, and all of your partners. I agree. I think the Baltimore program is so impactful, and they're doing an excellent job. And it's great for us to see the the case studies of the housing units that have been going through this process. One thing I'm wondering if you can talk a little bit more about, Colin, is this coordination of the Aging in Place Hubs program and what we're doing with energy efficiency and electrification measures, because I think, that to me is so valuable in enabling families to stay in homes that they've been in for 40 and 50 years for potentially another at least generation. And you're working with families directly to talk about these energy efficiency measures and these new technologies. So can we talk just a little bit more about what that process is like for our staff and energy auditors who are going in and working with families, and how they're coordinating with the residents to talk about what they're going to be doing?
Sure. And it all begins with the intake. The participants have different eligibility criteria, and to participate in the aging in place, you have to meet a certain age requirement. But then again, it goes with having cross-trained staff do this kind of work, completing a comprehensive assessment. And that's always at the forefront of all of our assessors, is being able to have a holistic evaluation of a home. And yes, they may be driven by, completing an electrification project, but they're also taking the time to look at other areas of improvement. In this particular case, um, there was, like I said, multiple trip and fall hazards, the things that were impacting the performance of the home from a healthy homes perspective. And it's just that it's the comprehensive assessment, and it's not becoming compartmentalized to one particular thing. And understanding that, if you have the partnerships in place, you have the funding resources at your disposal, take full advantage of that. A lot of times we often overlook that this participation in some programs, this may be the only time that we're able to get into this home. Why not do as much as we possibly can with the tools that we have? And it is important to at the GHM model, is to coordinate your efforts, and to being able to go in, identify the hazards, coordinating the different programs to ensure the funding is available, to ensure the funding limits are met, to ensure that the recommended measures meet the individual program requirements. And all of that just goes to support the ultimate healthy home outcome. And I think that being able to have the cross-trained staff to navigate that complexity of this model is really helpful, to not only to the family, but also to the organization as well.
Yeah, definitely. And our next question is about average costs, and something that I think we talked about early on when we were working on these case studies is the potential for maybe some sticker shock with some of the electrification work. So yeah, Jennifer from the audience asked if there is an overall average cost. She says $45,000 question mark. So I don't know, you can talk a little bit maybe about the breakdown of some of that scope of work and how it's parsed out by sort of that sector that we're talking about.
Well, I am smiling because if you're new to electrification, you're going to get some sticker shock. But if you spread it out among multiple funding sources, it's a little easier to absorb. On our energy efficiency side, that's funded by our energy efficiency funding sources, I would say on average, we fall in line really with the state average of about $6,800 is about where we'll typically end up. For our healthy home, on our healthy home side, that includes roof replacements, includes other type of general repairs. I believe our average is about 13,000 on that. Our electrical upgrades, we've been able to establish some really good partnerships with some local electricians. Our partners with IBEW local union connected us with some independent IBEW member electrical contractors that do residential work. We were able to partner up with them and negotiate some pretty aggressive pricing. And so on average, our electrical upgrades range between 4,400 to about 6,200, and the electrification upgrades with the systems, stoves, is about 22,000. And what we'll end up doing is, if our energy efficiency measures, if there's room in the cap, we will fund some of the HVAC replacement with our energy efficiency funds to max those dollars out to keep the electrification. We'll buy that down. But it's all just maximizing the resources, buying down where you can, and just, stretching what you have the best you can.
Yeah, thanks so much, Colin.
Yeah, and if I could just do a quick
please.
commentary on that
Yep.
too, especially for folks who may be tuning in from the policy side. And, we just set this webinar up for the implementation training, but imagine there may be some other folks that, like in my role, are thinking about both. I think it's helpful to think from both ends of the starting line, of starting with the home and adding electrification. Like, yes, there's the significant added cost of doing electrical work that, Colin talked about, that can have the sticker shock. Also important for folks on the decarbonization, the policy side, to recognize, like, even if you have the funds for the electrification, it's really important to have the plans for all this other stuff that Colin just walked through, that in a lot of low-income homes, especially in disadvantaged, disinvested communities, like, those needs are really significant and offer really significant benefits to the residents if you're able to deliver them. So being able to bring in those healthy housing, weatherization, basic rehabilitation, aging in place funds, so you can do these comprehensive scopes of work, can really maximize the benefits to the communities and the residents that you're serving.
Now, and Justin, you bring up a good point that I would like to expand on. So the healthy home, the averages that I was referencing is coming with the home probably worst case. In our programs that we work on, the energy efficiency programs, there are projects that will not need a significant, large, healthy home investment, meaning that these homes have met all of the existing criteria to participate in an energy efficiency program. Like, there's no reasons for deferral, that the roof is intact, there's no mold, asbestos, there's no structural issues, there's no plumbing issues, that they were able to receive a retrofit. And in those particular cases, that's what's going to drive the job cost down, because more than likely that existing energy efficiency program is going to be able to take care of a lot of the stuff, including some of maybe the equipment replacement, and you can just use the electrification dollars more as gap funding instead of funding the entire portion of it. And we've had a lot of success with our identifying homes that we completed under the Empower Maryland low-income energy efficiency program. We were able to leverage their dollars and making just a smaller investment, being able to get to electrification.
Great. Thank you so much, Colin. And I think that leads us pretty nicely into our next question, which is about some of our unit production goals. We have an audience member asking how many homes do you expect to complete over the next couple of years, and how could more homes be served? And Justin, it'd be great for you to talk a little bit more about what we're expecting in terms of funding streams that will help expand capacity in Baltimore to do more units in the future. So Colin, if you want to start us off on what your current production goals are for the next year or two.
Well, the electrification, we don't necessarily have a firm goal. In our pilot program, our objective was to jump feet first into it and just shake it out, see what happens. One of the benefits of GHHI is a lot of the issues we're facing here in Baltimore City, the lessons learned. We'll be able to take some battle-tested experiences and to be able to promote that throughout the country as this is what we've seen, this is what we've experienced. And so every home that we go into, we want to evaluate for electrification. And so far, I think that we're sitting at 48 completed electrification projects. We have about 20 to 30 more that are in progress, and then we have a couple of more that are slated. But our production goals as GHHI for a healthy home intervention for my division, we try to shoot between 3 to 325 units a year. And so that varies between 25 to 30 completed projects a month.
Yeah, and to zoom out a little bit, like I think, in addition to what we're able to deliver in our services, the hope is that we can see this happening consistently with other folks that are implementing programs and such. And that a lot of that's going to depend on there being funding both for the electrification specific measures as well as the enabling upgrades, whether it's weatherization, where we're lucky in Maryland to have great support for that, but then also the challenges that can sometimes cause deferrals from those weatherization programs on the healthy housing side and home rehabilitation side. So in Maryland, the Empower program, which again is the utility efficiency program, is going through a process this fall of the programs that both utilities and the Department of Housing and Community Development implement, moving to a greenhouse gas emissions reduction target. Previously had been electricity reduction target. So that change is expected to lead to more opportunities for fuel switching for homes. So the Public Service Commission has a hearing in October where they're working through what that's going to look like. There'll be a lot of folks in Maryland engaged with that. So we're hoping that that'll lead to some good updates to help support being able to do this consistently while still delivering the good efficiency upgrades and such that we know are really important as well. The federal rebates from the Inflation Reduction Act, we think will be helpful. We know they're not going to cover every cost either. So I think that a lot is going to depend on the alignment of the federal, state, and local, as well as philanthropic or other resources that can help fill in some of these gaps. As Colin said, we took this approach of jumping in kind of feet first and see that there's a lot of stuff to figure out and work on. So excited by what we've learned from that. We expect that to remain the case for some time too, especially as more folks get involved and deliver to more and more types of homes, that for some time there's going to be some uncertainty on exactly what resources are needed, what the costs are going to be, unexpected barriers that may be specific to a city or a territory or a county. So having those chances to be flexible and pilot this and be innovative will be really important to enabling scale.
Thanks so much, Justin. Our next question is about enrollment of households who have, it says students with asthma. I'm assuming that means it's a question about our partnerships to address pediatric asthma patients in Baltimore. So Colin, can you tell us a little bit about that and how we're receiving referrals and working on asthma trigger reduction in some of our programs?
Sure. Most of our asthma programs are focused on pediatric patients. However, we do not ignore our adult families who are suffering through asthma as well. And so we do not have an active referral process for older patients the way that we do for our childhood asthma families. But we do prioritize them in the same way. If someone contacts the office and says, I'm an adult with asthma, or I am an adult with COPD, we still take the same framework as our childhood asthma programs and apply it to those families. And so we focus on the indoor air quality, trying to identify triggers, with air purifiers, dehumidifiers, looking for other things with, other indoor air pollutants. We will even build out a supply kit that we give the families with children with asthma, and we go through a little bit of the same client education just reviewing proper cleaning techniques, reviewing the products that they should and should not be using that could be harmful to their indoor air environment. Talk with them also about potentially moving carpet or other rugs that are older that could be trapping asthma triggers. And so I guess in short, we kind of take a modified approach to offering services to our adult families that have asthma and COPD.
Great, that's really helpful. And yeah, again, a great opportunity to align healthy housing and efficiency programs and families to really have the multiple benefits from that work being performed in a comprehensive fashion. So thanks for that question. And it looks like we don't have anything else from the audience currently. I had one follow-up about induction stoves. We've heard from some of our partners nationally. I think especially some smaller states that maybe have not gotten as far into electrification measures in homes yet, that they're shying away from induction stoves currently because there aren't people in their markets that can respond to repair needs for induction stoves. So I think it's, my question is really more in general about some of the newer technologies and what we see happening in the field and how like the programs are bringing, installation and service providers kind of along with it. So is that something that you anticipate growing in the next few years as we see more energy efficiency programs adopting these practices?
I do, and it's something that has also been, and we always want to stress this with the induction stove. It is the cost of replacement is significantly higher, but the main reason why we chose to go the route of induction stoves is just the additional safety benefits that it provides, and it is not only just the performance. One main concern of a lot of program designers is this attachment that a lot of families have with the natural gas stove. That natural gas stove has probably been around their family, not this, but for a long period of time. A lot of families may have even had to depend on a natural gas stove to heat their home. And so one of the concerns that we had was people not wanting to get rid of it and what's a viable alternative. And that's where the induction stove comes in. It cooks just as fast as natural gas. It heats just as fast. But the safety component is what attracted us the most, especially with our families with young children and with seniors. You could be cooking on the top of the stove, and you minimize the risk of having hand burns for the burners. Now, I should say, with that said, all of the families that we do install an induction stove, we provide them cookware that is compatible with the stove, because not all cookware is going to work. And so we take it a step further, and we make it a small investment to provide them that cookware so they're able to use the stove. But as far as the repair and service, that's something that we have talked about at length. Some of the smaller rural areas, they may not have that access for a very long time. And so that's why we always reiterate that if you need to just follow the traditional electric stove, that's another viable option for you. And don't hesitate, or don't delay moving forward just because of a technological disadvantage or problems with technology. There's options out there that you can utilize to move your program forward.
Yeah. Thanks for that, Colin. So another question that I get that I thought either or both of you could probably speak to, and we touched on it earlier, Justin, really about the different state energy efficiency programs. What MEA and DHCD have been able to create policies and procedures around to support fuel switching. For people who are maybe joining from other states who aren't sure how those program policies are set and are maybe looking to engage some of their state leadership, what would you suggest for how they could go about learning more about what their utility funded energy efficiency programs, as well as their publicly funded ones, are enabling in support of some of these decarbonization and electrification measures.
Yeah, I'm happy to start, and then Colin, please fill in gaps. So, I mean, I think that GHHI has been really helpful to be able to work with folks who are implementing programs and can walk through the actual program manuals where there's a lot of guidance. So if you're one of those people, starting there is great. If not, talking to someone who can help you see it. Because again, there's going to be some criteria for when it's qualifies to replace that major appliance, usually some amount of an efficiency calculation, health or safety concerns that can't be repaired easily, some type of age qualification. So understanding those, I think, is an important starting place. Then my experience has been often those program manuals are set based on how the program structure is set up by something like a public service commission or a public utility commission. That's the case in Maryland, and every 3 years, although sometimes more frequently, they review the proposals for the plans that the utilities or the housing commission or department are going to run. And there's a public stakeholder process there. So coordinating with others who may engage with that or speaking at that conference on why it would make sense. One thing that seems to resonate in some places is saying that having that program guidance align with the federal funds that are available for rebates can be really attractive to the policymakers, because it lets them integrate those programs and make the most of funds that are not coming from the state itself, but instead are coming from the federal government. And then in Maryland, the reason the program is moving from an electricity reduction goal to a greenhouse gas reduction goal is because of efforts in the legislature. So there's often layers to this. The legislature in Maryland a couple years, or I guess last year, passed a law that said the program needed to be updated to fit with the state climate goals that had been set a couple of years back. So legislature responding to legislation. So that may be a necessary process, though there may be other programs living outside of that structure that can be direct engagement with an agency. Colin, I'll turn it to you for things I left out or things that are helpful from the ground side.
Yeah, from the ground side, it's very helpful. The organization that's been doing this type of work the longest is the Department of Energy Weatherization Assistance Program. And most states have fairly good size programs that are implemented through various nonprofit organizations. And it's always worth reaching out to these groups, having an open dialogue to learn about the landscape of energy efficiency in their particular state. In addition to that, they may even be able to refer you to contracting companies that are very familiar with utility rules, rebates, and also other initiatives that your state might be offering. We work closely with contractors who have a lot of experience doing energy efficiency work. And having those kind of partnerships not only helps you get educated on what's available, but also helps you get educated on the methodology and the approaches to not only the electrification, but also gives a different perspective on approaches to evaluating homes. And to Justin, he covered a lot of it, but just don't ignore your local weatherization nonprofits out there. They're usually a wealth of knowledge that can not only help you understand some of the existing programs, the existing policies, but they might also be able to connect you with workforce development programs and other resources that you can utilize to help grow or help you develop your planning as you move forward.
That is great advice. Thank you so much, Colin. So we just have a couple minutes left. Any closing thoughts from either of our panelists today? Justin or Colin, anything else you want to share?
This is just one thing. It's just like with electrification, electrification really is it's a beefed up energy efficiency program. You're just doing more. A lot of folks that I've talked to across the country seem intimidated. It's intimidating because you're dealing with new technologies and new processes. But if you take a step back and look at it, this technology that you're going to be utilizing has been around for a long time. It's been tested, it's been verified, and there's studies after study about the benefits of doing this kind of work. So don't let these new things get in the way of expanding what you're currently offering. There's existing companies out there and organizations that will be more than willing to help you in any way that they can. And this, please take advantage of it and braid and align all your resources, maximize your efforts, because it's the families we serve that will benefit from that. And that's the goal of what we're trying to do.
Absolutely. Thanks so much, Colin.
Yeah, I agree wholeheartedly with what Colin said. I think the other thing is just the conversations we have with clients afterwards, they so appreciate just how full these scopes are of the work we're able to do, right? The appliance, the stove with the other aging in place and efficiency benefits. And it can be really impressive to see the work that goes into it and the benefits that people appreciate on the other end. It makes it worth taking on so much, I think. So yeah, we're appreciative of the chance to share the work out too, especially with other folks interested in it, and enjoy the conversation as we're working on how to do this and scale this and learn all the lessons from new things.
Absolutely. And we look forward to following up with everyone and sharing some of our evaluation of this program as we're working through units. It's exciting to hear that we're at 48, and yeah, look forward to seeing what some of the aggregate benefits of the investments are going to be as we look at the pre and post intervention cost savings and health benefits and all the other good things. So I think we can leave it there. Colin, thank you so much for taking time to join us and speak with our audience. I know everyone will appreciate learning from your experiences. And Justin, thanks as always for joining me and helping get the sessions planned out. Thank you to all of our attendees. As we wrap up, we're going to share a post session survey so we can get your feedback, and we look forward to staying connected with you. We've got one more session next week, and we'll share more details on that via email when we share the recording from today. So thanks again to Justin and Colin. Just really appreciate your time and expertise as we move forward in this this training series. All right, so let me do the last, there we go, our post-webinar survey, and I'll just leave this up for a couple minutes as people sign off. Look forward to hearing your responses after the fact, and hope everyone has a great afternoon. Thank you so much.